Health, Human, and Social Services meeting to order, please. First thing we need to do is approve the minutes of last month's meeting. Would someone like to make that motion? Supervisor Sokol, seconded by Supervisor
Like it?
McGowan.
You recognize that sweatshirt?
Yes, I did. All those in favor?
Aye.
Approved, carried. And with that, we'll turn it over to Chris.
Good morning.
Good morning.
I had talked to the chairman before about doing a presentation on the summer youth program, and so that's what I have for you today. It's just informational only. No actions are required. But I thought it was important as we talk about it to differentiate. We do have two sources of funding that we use for youth, and this is what we commonly refer to as the summer program, which is money that comes through the state under the Temporary Assistance for Needy Families, as opposed to our Workforce Investment Opportunity Act funding. And so that's what we're going to talk about today. So there is an eligibility requirement. I don't want to go into a lot of detail, but I just want to make you aware of it. Since it's funding through the what we refer to as the TANF program, there is eligibility for youth between ages 14 and 20 that are family assistance recipients, former family assistance recipients, or who transition to safety net assistance, or members of households with incomes below 200% of poverty. And to just give you an idea, 200% of poverty is about $50,000 a year for a family of four. This year we received $109,000. We had 52 youth that were employed. The main focus of the program is to put kids to work and provide a meaningful work experience. And we're also required to provide some financial literacy. So the program actually begins with a meeting of all the youth in our office. If you can imagine 52 youth in one place for most of the day, where we fill out all the paperwork, teach them about finances, how to save money, how to budget money, and things like that. We had a total of 85 youth who were initially contacted. Those were youth that started an application. They fall off for a number of reasons. Some of them find jobs on their own. This really is designed to be a first job for kids. So if they can find a job on their own, we consider that to be a success. So there is quite a fall off from the number that are initially contacted to how many we actually employ. Some are over income, and then others just don't complete the application. And when that happens, we call the parents. We work with the kids and their parents to try to get the application completed. Some of these kids we just don't hear back from. We'll make all the efforts that we can to reach out to them, and some of them just don't hear back. We had 22 work sites this year, a total of just under 7,900 hours worked. The flyer is the primary outreach flyer. Primary outreach is through the schools. We reach out to the guidance council offices, and we actually go to the school on designated dates and times to collect the applications from the kids, hand out and collect the applications. And then we go back and follow up at a future date. We also work with social services on some special population groups that I'll talk about. So we did a similar presentation to the Workforce Development Board last week, and the first question they asked was, well, $109,000, how does that compare to prior years? So I added this slide just to give you an idea. The money has been going up since 2014. Part of that is to account for the increase in the minimum wage. But it's actually been more than that, as you can see. And one of the things I do want to point out in these numbers, back in 2014 and 15, we had waivers from the Workforce Investment Act. so that we could just put kids to work for the summer and then not have to do any follow-up services. So that's why you see the numbers go down fairly dramatically from 15 to 16, and they've since gone up as the money has increased. Questions?
Yes,
Yeah.
thank you, Madam Chair. Going back to the previous slide, you don't have to change it, but you had 85 kids that you contacted.
Yep.
You're doing it through the schools.
Yep.
Do we know that through the schools, and they would know,
Mm-hmm.
have we touched every single eligible child for this program?
Oh, I'm sure we have. Yeah.
So that,
I don't think there's any way that we could.
well,
Yeah.
I don't see there's any way you couldn't. I think we're doing it through the schools know everybody.
Yeah.
They should be able to go, Billy, Peter, you need a job, you're eligible, fill out this application.
Well, a lot of it is that way, but I guess I shouldn't have been so quick to say we haven't. That is how it works. A lot of it is word of mouth. The guidance counselors know the kids. They literally call them in,
Okay, well, as long as I just want to verify that they are doing that,
Yeah,
not
there is a
just
real personal
taking your
touch.
flyer and going, well, yeah, I think we have one person, and you're not really getting actively involved with it.
It depends on the school, and honestly, some are better than others, and the ones that aren't as receptive, we take extra efforts to work with.
Thank you, thank you.
You're welcome. Yeah, if anyone else has questions, feel free to ask, and if I don't have the answer, I'll certainly get it for you. So a lot of this information comes from the final report that we have to file, so I just took it and added it to the PowerPoint. The ethnicity, I don't think is any big surprise. It just reflects our county. The characteristics, female, I thought was kind of interesting that it was even this year. The target groups, these are the target groups that the state has, children in foster care or youth with a disability. And as you see, we had 12 out of 52, so we thought that was a pretty good response this year. Ages served. This gets really interesting when you start to talk about the ages, because we have to comply, of course, with all the child labor laws. And finding work for 14 and 15-year-olds can be very difficult. And I think there's a reason why we had a larger number this year. I think older youth were able to find jobs on their own. We ended up with a high number of 14 and 15-year-olds. When I went back and looked at prior years, there were years where 17 was the most common, and we only had a handful of 14 and 15-year-olds. But they're harder to place just because of the restrictions on the type of employment they can do. They can't operate machinery. They can't handle knives. So a lot of places that may be willing to take on a youth really can't use a 14 or 15-year-old. We had one specific story. We had a 14-year-old in Lake Luzerne that really wanted to get in the program, and we couldn't find a place for him. And we were able to place him with the Adirondack Folk School. And they had never participated before, and it worked out really great. They loved him. They brought him on after the program was over for some weekend help as well. Youth served by community. When I first looked at this, I was a little concerned that we weren't reaching the North Country enough. But then when you do the math, it tends to reflect the general population. About 2/3 of the population is in Glens Falls and Queensbury. That's where most of the job opportunities are. The other real challenge is the ruralness of our county in finding employment where they can get to. A lot of them don't have, there's no mass transportation. A lot of them use carpool and transportation to get to work. So, we need to find locations that are walking distance or bikeable. It does get to be a real challenge. I know this is kind of small, but it is in your packet. So this is a list of the work sites. It's kind of for your information. We have some work sites that we've worked with quite literally every year that have really been great in terms of supporting the program. Community Action Agency is one, and we've talked about that a lot. Cornell Cooperative Extension. It is just a great experience when the youth go up there and they rave about it, and they asked to go back the next year. The other big one, of course, is Operation Food Chain. And I haven't really talked about that this year, but this is the program where we contract with BOCES to serve lunches at Eastfield to kids in that neighborhood. Community Action, through a grant, buys the food. We hire the chef from BOCES. Along with the youth, he prepares the meals and then serves it. They're the ones that prepared lunch at the award ceremony. The other one that's a annual contributor is the YMCA. We had the CEO, Brian Bear, as our guest speaker at the picnic. We had six youth as assistant counselors in their recreation program. All 6 of them were offered jobs by the Y, evenings and weekends during the school year, and then they anticipate that next year they will be full counselors. So they will transition from the summer program to the Y's payroll.
The question.
Yeah, go ahead.
Go ahead.
How much do we contribute, or let's say, how much do the companies contribute to the percentage of costs of these employees?
So we pay all the salaries. It's minimum wage, and the only thing that they really participate in is supervision. So they provide supervision. They provide the job description, the work experience. They're really required to be mentors, because it's really more than just supervising someone. They're mentors, but we pay 100% of the youth salaries.
That's a further question. I know that you've got a mixture, public, nonprofit, and private, and there were several privates.
Yep.
It seems to me that if it works for those privates, it would work for a lot of the privates, especially during the summer. Do you contact everybody, or how does, I see the Georgian Hotel is there,
Yeah.
and there are a lot of hotels.
So
in various places around the county, probably.
the Georgian's an interesting example. They contacted our office, it was probably in March, and they said, in anticipation of the tourist season, we're looking to see what we can do to get more employees. So we went up there, looking to help them with just general placement. And while we're there, we talked about the youth program, and they said, well, yeah, we'll take you. So that's really how that evolved. It was, a general recruitment effort that led into them asking for me as well. And you're absolutely right. I mean, every employer that we talked to this past summer, they wanted bodies. Someone that will show up on time and work. That was a very common theme. And when we do especially when we do a private placement like that, we really hope that if we put a youth there this summer, that the next summer they will pick up the wages, and it'll be a private placement instead. So
Seems like a great opportunity for private businesses to get a free sample.
Yeah, I was gonna say, you can try them out.
Try them out for nothing.
Yeah.
Thank you.
But we don't do any special outreach for the private. We have a huge mailing list of agencies, and of course the towns and communities that we send a package of information to, worksite agreement every year. Some of the other outcomes, and this kind of goes to some of your questions. As you may have recalled from the prior slide, 27 of the youth were 14 and 15 years old. No surprise then that 25 of the 52, it was their first job. 2 of them said, yeah, I babysat once, and one mowed his neighbor's lawn, but it was really their first job outside the home. 8 of them were hired after the program ended, so they transitioned from public payroll to private payroll. I mentioned the 6 youth at the Y. We also had 2 leave for private placements. One was at the Georgian, I forget the other location, where they stayed on after our program ended. The business hired them on to stay on through the end of the season. And we also had 4 more work sites. I did have a series of photos. I guess the version of PowerPoint I had wasn't compatible, so unfortunately you don't get to see them all. Just the collage at the end. The award ceremony is always special to see the kids get their
other questions from the committee? No, that was great. Thanks, Chris.
Thanks, Chris.
You have something else on there, Chris?
I do. The other one, so this is the chief elected officials agreement for the Workforce Development Board. This was authorized back in 2015, and typical to the resolution, it's at the end of your package list. Typical with the resolution, you know, it read in language acceptable to the county attorney. So what happened was at the beginning of the new fiscal year for the first board meeting, they were at, you know, they went through accounting and asked, you know, do we have all these up to date? And it is required that when there's a change in the chief elected official, that a new agreement be signed. So I contacted the county attorney's office and I said, you know, I think we're covered from this prior resolution, and they said, yeah, we are, but you ought to at least let the committee know. So this is an information-only kind of thing, but it's really a reminder of the obligations and responsibilities that the county has for the Workforce Innovation and Opportunity Act. You know, the fiduciary requirements. Our department has been selected in 3 of the last 4 years to be part of the county audit, which is kind of unusual, but you know, we do have to go through all the same financial management restrictions as all the other county funds, and it's just, this agreement just speaks to some of those issues and requirements. You know, every year I bring to you the budget for the Workforce Development Board. We review it, approve it. But again, it's just a reminder of the responsibilities and the duties. And if there's any questions, you know, feel free to let me know.
All right. Thank you very much.
You're welcome.
Thanks, Chris.
No other questions? All right, then. Thank you, Chris. Have a good rest of your day. We'll move on to social services.
Edward to sit.
No numbers today?
Numbers?
Usually put the, you know, 1, 2, 3.
Oh, yeah, there's only a couple
Throwing me
of
off,
them
Chris.
in there,
I'm
so.
a little disappointed.
They didn't need to put the tabs in there.
We're short and sweet
Makes them easier to
today.
recycle.
That's right.
Thank you.
Straightforward and simple.
Get her a cut from your budget.
I'm good. I have all this, I read all mine. You need one? Okay. Thanks, Chris.
Thanks, Chris. You guys need some, right?
Thank you.
You're welcome. Good morning, everyone.
Good morning.
Morning.
Today we just have one item that we're asking for, and that's to create the position of social services attorney and delete the position of assistant social services attorney number 1. We had a resignation from that position, and that person fortunately did fill our part-time attorney position, so they're still on staff, they're just part-time now. So with that said, we've been looking forward to maybe having an attorney who actually has a little bit of supervision duty within the department in terms of what kind of cases certain attorneys might take on and the distribution of cases with the various attorneys. And someone that might also be handling more difficult, complicated cases for the department. So with that said, we are asking to delete the position of Assistant Social Services Attorney 1 and create this new Social Services Attorney position, which we have had in the past actually, and we hope to have in the future.
All right, would someone like to make that motion? Supervisor Loeb, seconded by Supervisor McGowan. Any discussion, Supervisor Loeb?
Yes, thank you, Madam Chair. If I may, Chris, would you explain, you had a lot of pronouns there, unsaid, but how many attorneys in the different positions, and who resigned, and et cetera?
We have, we traditionally had 2.5 attorneys. We had 2 attorneys at DSS years ago. We had a lead attorney, who was the social services attorney, and an assistant attorney, and we shared an attorney half-time. So we had 2.5 attorneys. There was some changes in the organizational structure over the last few years, and if you remember correctly, a while back I had asked to delete the position of Deputy Commissioner, Chief Legal Counsel, and create just a Deputy Commissioner and a half-time attorney. A couple weeks ago, we had this one attorney here resign, had some other obligations that...
But which one?
It was Gus DeStefano.
No, you've got your lead attorney, you've got a first attorney.
It was an assistant attorney, because all we had was 2 assistant attorneys. Right now, we only have, we had 2 attorneys, and they were both assistant attorneys. We did not have that lead attorney position anymore, because that was combined in the Deputy Commissioner Chief Legal position, I don't know, 3 or 4 years ago. So what we had was 2 assistant attorneys, and we had the open half-time assistant attorney position. So the one of the assistant attorneys, Gus DeStefano, resigned and did accept to stay on in the half-time position. So right now we have 1 attorney who's full-time, assistant attorney, and that's James Lesperance, and we have a half-time assistant attorney, and that's Gus.
Okay.
So now we're looking to create this new position, which we previously had, so we'll be back to what we had several years ago, the exact same format, basically.
But where would the assistants fall into the...
Well, what would happen is this person, this position of DSS attorney would handle all the cases that came in and all the legal work that came in and assign it to other attorneys based on their experience and the needs of the department. Right now we don't really have that. We kind of have, things going wherever, and it doesn't always work out to be the greatest situation for the attorneys or the department. So what we want to do is have this person be able to look at any work that comes in and decide if it's going to go to either Gus or to James. In some cases, this person will probably be keeping some of these cases themselves, because the expectation is that they will have a caseload as well, and they will be litigating, especially on cases that require more experience and insight into certain areas. We have found that there are areas at DSS that we do need to have more legal coverage in, especially in the areas of resources and fraud and child support. We also have been having more appeals through the family court, some of those cases, and they get pretty tricky. We just went through one that was quite stressful. So we're looking to get back to the point where we have like a social services attorney who can, manage the legal unit. And I think that from a structural standpoint, it's going to be helpful as well. If you remember correctly, we recently changed a position to legal secretary. She also happens to be a paralegal, so with that said, I think our legal department's going to be a really tight, well-running unit once we get this next attorney in place.
All right, any other questions, Supervisor McGowan?
Well, of course, this is already in your budget.
Yes, yeah.
Ms. Bramer?
So you have one full-time attorney right now and one half-time attorney?
Yes.
Okay. What is the title of the full-time attorney?
Assistant attorney, assistant social services attorney.
Does it have a number? To get rid of that? Like,
No,
this
that,
one you were trying to
the
delete.
existing one, the one that we're deleting is number, it should be on there, actually, number one. Yeah, that's his number right there, that's Gus's position, that he just resigned from. So Gus DiStefano just resigned from Assistant Social Services Attorney number one.
And so this other full-time attorney, are they assistant number two?
Yes,
Okay. But you're gonna leave it that way?
yes, for now,
Okay.
yeah.
Supervisor Leggett?
And then salary, you're bumping up the salary, 4,000?
Yeah, we're bumping up the salary a little bit, for that position because they are gonna have more responsibilities. So I think it will, you know, attract a stronger group of, candidates for the position.
Any other questions? Supervisor Bramer, I saw her hand first.
Thanks. I want to make it part of the creation of the new position that they must be a licensed attorney.
Absolutely. I would not even consider interviewing someone unless they were already licensed and a member of the bar.
Mr. Logue, last question?
Thank you, Madam
Oh,
Chair.
go ahead.
To save confusion
Mhm.
later down the road, it would make sense if you're eliminating the person who's now assistant attorney number one, but you're keeping the person who's now assistant number two, but you want to eliminate one of the assistants, that we make the person who's currently assistant number two, assistant number one, and then we eliminate number two. So you don't have to explain this again.
All right.
Don't you think
I think
whatever
the
work-
reason why we, just to elaborate on that a little bit, is at DSS, each position has an actual number. So any position over there has a number, and it just so happens that this person, even though they were hired after the Assistant Attorney DSS Attorney number two, actually has worked there longer. So it just happens that that's the number of the employee, that specific position within the budget. So, we would have to do some other things on our side to move that around as well, but that's the reason why it's a little bit confusing. So if you notice in the past when we have openings, each, like if it's a caseworker or if it's a social welfare examiner, there's a number attached to it, and that's the specific, employee number for that position. So that's why we always use that number, because that's the actual number of the employee who left that position. So right now, I actually probably couldn't put it as social services attorney number two, because that position is still filled. It's social services attorney number one that resigned, so just to clarify that.
Whatever works for them, I think, and that's what they've been normally doing. I think we should just leave it up to them to kind of.
Good thing is there's only two of these positions.
Right.
It's
All right.
not like there's 25 of them.
All those in favor?
Aye.
Opposed? Carried. Thank you.
Thank you. And I do not have anything else other than just a little update on some things, which I will quickly go through here. Back on October 3rd and 4th, I attended the New York Public Welfare Association Social Services Leadership and Policy Forum in Albany. Some of the topics we discussed were trauma-informed care and putting that into practice, family-based care to increase kinship placements, and there was also a symposium on homeless issues, which are directly related to substance abuse affected and developmentally disabled peoples. On the 5th of October, I attended the Warren County Collaboration Committee meeting at DSS. The topic was Raise the Age, and we had a couple people there from probation who presented a nice little presentation and discussed possible impacts on our systems within the county as this rolls out over the next couple of years. On the 9th of October, I met with Chris Hunsinger from Employment and Training and Kelly Barker from our TA unit to discuss possible process and communication improvements between our agencies. And on the 17th, I attended a Deputy Commissioner's Leadership Network conference in Albany, because it was, as you know, I don't have a deputy commissioner, but it was a very important topic, so the two topics were continuation of operations plan, and presenting and addressing the issue of recruitment and retention within social services agencies. It's a recurring theme throughout the state that recruiting people and retaining them it's getting tougher within the field. So that was very valuable as information that I'll be able to give to my deputy commissioner when I do hire one. On the 24th, Julie Montero and myself met with OFA Director Dee Park to discuss some issues and possible improvements that could be made in regards to collaborating on some key issues and contract issues. And last week, I'm very happy to report that I had final interviews for the deputy commissioner position. I had 3 finalists have second interviews, all really solid candidates. It's going to be a very tough decision, but very solid candidates. We had 8 people that were interested, so it was pretty competitive. We had 6 people who actually followed through with the whole process, and we had 3 finalists in the end.
Great,
So
sounds good.
good news to report. Hopefully I'll be able to let you all know that we have a deputy commissioner and perhaps bring them to a meeting and introduce them.
Great, we'll look forward to that then. Good. All right.
September regular expenditure report. Our expenses were a little bit, up a little bit, September 2017. Mostly that was due because we had an extra pay period in the month of September. That increased the expenses. Other than that, we're pretty much on target. Our revenue is in keeping with the they're up a little. 2017. Overall, we're on target, both budget and revenue. And for the overtime, we're pretty much holding steady. Hopefully some of the core training is winding down. We're gonna have a couple of case workers that are gonna be ready to go here pretty soon. Just in time for a new start.
But you're comfortable with where you're at then with everything budget-wise then?
Yeah, I think, not last month, but the month before, I moved money to cover expenses for the year end.
Okay, good. Thank you. Any questions from the committee? All right, thank you, Julie. Edward?
Okay.
Hi, good morning. I just have one action item. I would like to make a request to create and fill a part-time food service helper position. Annual base salary is $26,743. The effective date that we're tentatively looking at is November 26th. In conjunction with creating and filling this position, we intend to delete the position of institutional aide number 7. Funds are in the budget code A6030-130 under regular salaries. Personnel officer has reviewed and approved this request. It is a mandated position, and it is 50% state reimbursed.
I'd like to make that motion. Supervisor Loeb, seconded by Supervisor McGowan. Any discussion? All those in favor?
Aye.
Aye. Opposed? Carried.
Thank you.
What is that?
Oh, it's Chris dragging his paper over the mic.
I'm gonna blame it on Julie.
I've enclosed our census report through the end of September, and also the overtime report. Take a look at that. Know if you have any questions.
Any questions from the committee on either the overtime report or the census? Ms. Bramer?
Why are there two numbers right here at the total?
I believe the second line, the 789.3, that was through 9/30, because I just recently added, I recently added the week of 10/14. I think that might be the explanation for that.
So the one up above is, 1014.
That would add up.
Yeah, yeah. The 885.8 is through 10/14, right.
Supervisor Loeb?
Just want to comment for a department that requires 24/7 staffing, looking at the percentage of overtime, it's quite low compared to other departments.
Right. Okay. Edward, anything else?
I just wanted to say that we, continue to promote the home. We did have an article in the paper recently, the Sun, the Adirondack Sun, about one of our residents who turned 100. So we got some publicity there. I just made a copy if you want to pass it around. Says she's a tough old bird, so that's good. If you want to live a long time, come to the countryside.
Great. Like that.
Promotion.
If you make it to 100, you're
Doing
doing
pretty good.
okay. That's right.
And before she was,
Supervisor Connolly.
story.
Yeah, thank you, Madam Chair. A couple of months ago, I had a chance to go to the countryside with you, Madam Chair, one of the commissioners met. And my takeaway was, first of all, the staff really loves what they do. It's a very motivated staff, and it shows, in how they conduct themselves, how they interact with the residents. It was a marvelous thing to see, and they were very expressive as well about how much they enjoy working and how much they enjoy the work that they do. It was also apparent that the facility was clean and orderly and well kept, and that's of course always good to see. And the residents there really, I think, very much appreciate being there, and their playing cards, I think, when we got there, and really, I think, having a really fun time. I think though that going, and also it's good to see in the proposed budget generally pretty much the same type of budget, order of magnitude, might be a little increase, but as last year as opposed to proposed for this year as proposed for next year, and that speaks well for the management of the facility and the cost containment and all that. But I think going forward, it's also clear that a facility like that has larger needs. At some point, the roof will have to be replaced. At some point, there will be more major kinds of requirements, parking lots that have to be redone, that kind of thing, and that aren't easily handled out of a tight operating budget, is my point. And so, but I was happy to hear that those types of matters are going to be dealt with, and a plan will be put together that continues Countryside on the right path, and that we have a business plan going forward that reflects the needs of the facility going forward. So I was very much encouraged by what I saw, and I certainly applaud. I think we have the right people in the right spots now to do, I think, an even better job in a facility that's already doing a splendid job. Thank you.
Thank you. You are so correct on that, Mr. Conover. Yes,
I
Edward.
also just want to add that our wastewater project has commenced, okay? So if you drive by, if you come up, you're going to see a lot of digging and some construction going on. But we have been assured that we will have access, continued access to the building and the main road for visitors, families, EMS, whatever is needed. I did notify all the families. I called them personally and told them what was going on, so they're all aware. I also made them aware that if during the project there are any problems or any issues they have at all, to call me right away and let me know. Consistent with our safety plan with the Department of Health, I did an in-service training program with all the staff, letting them know what was going to happen, letting them know what they need to be on the lookout for. And again, anytime there's a problem or an issue, 2 o'clock in the morning, any discoloration of the water or any odor or anything at all, to let me know. I did also go out and introduce myself to the site manager. We exchanged business cards, so he has my number, I have his number, just to make sure that we're in communication if anything does come up. So we did, a plan for this. I don't foresee any problems. I do know that at the completion of the project, they will be making the actual physical hookup that I was told would take hopefully no more than an hour, but we're planning for maybe 3 or 4 hours. In the event that we do lose sewer system during that time, we have backup plans in place to ensure the continued operation of the home. So just wanted to make everyone aware of that.
Sounds like you've done a good job of trying to get all those bases covered. That's good. Is there anything from the committee? Supervisor Bramer.
Not on this aspect. This is the first committee meeting we've had since the meeting regarding the Office of Aging, Cedars site.
All right, but could we finish up this one, because this really isn't part of Social Services Countryside, so if you want to bring that up, can we do that afterward? I would we're running so far behind, I would just like to, thank Julie and Chris and Edward. So if they don't have anything else, I would kind of like them to be able to go on to the next.
Madam Chair, I just have one more small thing. I'd like to follow up a little bit on Supervisor Loeb's question in regards to the outreach from employment training for youth who are employed in our county. They have been very diligent about incorporating foster children and children who are involved in the system and getting them jobs. So I'd like to thank them and let you know too, because you had a question about that in regards to face-to-face. Our caseworkers literally get the stuff handed to them. Our caseworkers hand it to the kids and say, "We got your job, let's fill this out." So just to follow up on that aspect of it as well.
Very good. Thank you very much. Okay. Thank you all.
Have a nice day.
Claudia, while we're waiting for the next group, what was the sum and substance of it?
Okay,
Yeah, I understand. We're running so far behind. Claudia?
Thank you. So the meeting, a lot of the concerns had to do with the newspaper article about...
Right.
Okay. I think that's under control. There were some concerns about the food quality, but I think Julie is handling that as...
Right, because she has to send out the RFP on all of those. And we're working on the other issues as far as like the manager, whether we need to move forward with a full-time one or not, so.
Well, that's what I'd like to know. Are we...
Sit right down, ladies.
We have given her, no, right at this point, we have given her a couple of months. She has another gal that she's giving more hours, and we've said to her, let's see how this works out for you, and then I'll discuss this with her again in a week or so, and we're gonna let her make the decision as to whether she needs to be going out with that or not.
We're making having Dee go, I'm sorry, can you just...
Well, no, because that is her department, so that's why she should be handling it.
No, is she going to the site, is that what you're saying? Who's the person
No,
with
she
the
has a
extra?
gal that had been over there that was working like only a few hours a week. She is giving her more hours, and she's more like in an overseer position as well.
Okay.
So, and she thinks that's working out, but like I said, we'll be touching base with her. I felt in all fairness, we should be able to give her a couple of months to see whether it works out that way, or whether we do have to go out for the full-time manager. That's about where we're at this point. Supervisor McGowan?
Yes, I was at that, the meeting that, day. I was actually there, the day before, talking to all the divers, apologizing for what was in the paper, and that was not the, intent of anything that was discussed. But, I was at the meeting, and I just wanna say that we run 70,000 meals out of there a year. And to me, that's a restaurant. And most restaurants have a good manager, and I really think we need to do our due diligence, that we have the proper managing set forth, and the skills of being able to deal with the different situations that are over there, because it's kind of a little bit of a hostile situation.
Well, we are working on that, and we're very much aware of it.
Okay.
But by the same token, a person who is there really is not kind of responsible for running the meal site, so to speak. You know what I'm saying? Someone who's a resident there sometimes seems to me as being very vocal about things instead of letting the people carry out. Claudia, maybe we could just discuss...
Just one more comment. I want you to know that I also talked to our staff, and they're struggling.
All right, well, then I don't...
It's not just the people, the residents who are saying they don't like what's happening.
Okay.
Well, that's what I was really, that's what I was, I have also talked to...
Not a problem. I will look into that.
Okay.
I don't have a problem. Janelle, ladies, I'm sorry we're running so late, but
All right,
we're ready.
thank you.
Mm-hmm.
The first item of business is to request a resolution to authorize a contract with Kathleen Ryan, who is a physical therapist, and we're looking for her to provide therapy services, and it's just something that we can need and we can get revenue out of it.
All right, Supervisor Sokol's making the motion, seconded by Supervisor Loeb. Any discussion? All right, all those in favor?
Aye.
Opposed? Carried.
Okay, the second is to authorize me to sign a memorandum of understanding with Adirondack Health, and they are out of Saranac Lake, and it's for a period of 5 months, and it's for us to utilize touchscreen devices and kind of test them out to see if they'll be viable for our home care agency to use. There's no cost. They're letting us do this because the equipment's available, and there's really no drawback.
All right, sounds good. Motion by Supervisor Loeb, second by Supervisor Sokol. Any discussion? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
The third is to amend a contract agreement with Delta Health Technologies that was dated back in '08 to include Hixney bi-directional interface with our CHOP, not to exceed $13,950, which is a one-time developmental fee. As soon as the productive date happens, or within 6 months of the effective date, we're looking at $116 monthly fee that we would have to pay in advance, and we're looking to use our district money for that.
All right, someone like to make that motion? Supervisor Loeb, seconded by Supervisor McGowan. Question? Claudia?
Thank you. Can we get this on a calendar year, this contract?
I might defer to Sammy for that.
I think, it might be when we initially started. We could ask them, but, like their other contracts, we're starting like maybe March until, like everything.
So all of your contracts don't start January 1st?
No, definitely not. Yeah. I can check. I'll check for you.
I think it can take up to 6 months to even get it started.
Right, all those
Well, if that's the case, you must just have to start January 1.
Yeah, I mean, but there's a process to get it started that we ourselves don't really have anything, I think there's paperwork that's involved.
Well, they have to develop the program. That was what it was initially about.
The contract's
So
actually
it could
already
be
in
up to
place.
6
We're
months.
just looking to amend it to add these extra services that are required for us to have. And they're telling us, the vendor's saying it would take 6 months for them to be able to get that up and running for us. So that's why it's written that way, but we can certainly look into your question.
All right, any other questions? All right, all those in favor?
Aye.
Aye. Opposed? Carried.
Right, the next resolution is a budget adjustment, if you wanna refer to attachment 1, and Ton, our fiscal manager, will.
This is basically just that part-time employees now have health insurance, so I need to move money, $5,200. She's utilized in 2 different programs, and with payroll, it's just, so I just have to move money over to our family health program to cover that health insurance. That's my guesstimate to the end of the year.
All right, motion, Supervisor Sokol, was that your hand up for that? Seconded by Ms. Bramer. Any discussion? All right, all those in favor?
Aye.
Aye. Opposed? Carried.
Right, and there are no pending items. Information for discussion and review, I'll have Ton review our revenue and expenditures, which is attachment 2.
Attachment 2 is our, as of October 22nd, our year-to-date totals. We have just billed for the month of August for our home care. We got the new system that we talked about, so that's a little bit behind, but we're working on that. We've had quite a few tickets we've had to put in to work with them, but so far we're working on them to get September closed. Just to bring your attention quickly, the payroll again down at the bottom. With our new system, we have had to work with our nurses in charting and getting overtime, so it's brought the overtime up. But overall, we are 67.52% of the budget, where last year at this time we were 79.04% of the budget. So we're still under budget where we should be, which is good as a whole, but our overtime has increased, and it was primarily due to this new system. That's slowly been going down now. It's slowly actually a little bit more than, well, it's been better. So we're hoping that that'll almost disappear.
All right, thank you. I'm sorry, Ms. Bramer, question?
It looks like our year-to-date revenue is much lower than it was in 2017. Are we going to catch up?
Actually, according to last year, when you look at the next page, we are actually above last year at this time, the exact same date. I print the numbers the exact same date. So it just looks low when you look at the whole total. That's the whole year, last column, and that's only to date, right.
Okay.
So attachment number 3, again, will give you a comparison of October 22nd last year to October 22nd this year. Again, the payroll is on the first page. Our contractuals are mainly due to our preschool program, a little in the child, but again, we had to wait for new rates to be approved by the state before we can bill. And a lot of places, like the hospital and a couple other places, are doing different kind of billing. We have to make sure everything that's on that bill before we can pay it is correct, so that they've had to be held, but we're working with them and getting that all straight. But you'll see in this case, yeah, that so far year to date that we're above budget in revenues.
Great, thanks. Good. Thank you.
All right, status of referrals is attachment 4. Val, do you have any comments?
Nothing. I was quite pleased that it's better than 2017 and 2016. I thought it looked good, 5%, up, so it looks like, we were down back in July. But I think a lot of that could be because that's when we started the computer switching, and it looks like we're on the mend.
Good.
All right, and then the other reports, the rabies program is also attached, and so is the emergency response and preparedness activities on attachment 6. As far as program updates in our CHA, we're still open, looking for positions, and we're in a continuous recruitment at this point. We have 4 positions open. And that's all I have.
All right, questions from the committee? Any questions from the audience? Supervisor Garrity.
I hate to do this. If somebody gets bit by a cat, who do we call?
Public health. Public health.
Ghostbusters.
Public health. We have a rabies program, and we follow up on that. If there's same owner, same victim, our public health department does that. If it's different owner, different victim, we have animal control officers that we're paying out of public health to verify the health status. Absolutely.
Any other questions? Okay, there's no further discussion. I'll entertain a motion to adjourn. Supervisor McDevitt, second by Supervisor Loeb. All those in favor?
Aye.
Aye. Carried. Thank you. Have a good afternoon.